Wonderful. Well, I'm going to make a start now. So welcome everyone to Vivaldi Social Care. My name's Zoe Fry. I'm one of the directors of the Outstanding Society, the director of nursing, and I've been involved in Vivaldi for a few years now and leading on the onboarding. If we could go to the next slide, please, Mike. Excellent. And could I ask you to introduce yourself, please, Laura?
Yeah, hi everyone. So as you can see on the slide, I'm Laura Shallcross. I'm Professor of Public Health at UCL, and I'm the academic lead for the Vivaldi studies. Thanks.
Thank you. And Chris?
Hi, I'm Chris Day, Director of Strategy and Engagement for CQC, the regulator of health and care across England.
Lovely. Thanks, Chris. And Judy?
Good morning. I'm Judy Smith. I'm a care home resident. My background, I'm 89. My background is that in the past I was in advertising and marketing, and now I've spent 30 years involved with the voluntary sector, so I'm particularly interested in this scheme. Thank you.
That's wonderful. Thank you, Judy. And I know we'll hear more later about how you're involved with Vivaldi Social Care. So thank you for joining us today. And Mike.
Good morning, everybody. Thanks ever so much for coming along. My name is Mike Slater. I'm a project specialist with the Outstanding Society and also a pharmacist by background. And been involved with the Vivaldi project for a couple of years now, mostly working with digital suppliers and in the training. Hi.
Fantastic. Thanks, Mike. And Kate.
Hi, good morning. My name's Kate Miko. I'm a campaigner with Rights Residents. My mum was in a care home for about 8.5 years, and I'm a member of the Adult Social Care Engagement Collective and have been involved for about 2.5 years.
Wonderful. Thanks, Kate. And Lucy?
Good morning, everyone. My name's Lucy Knight. I'm the Vivaldi Social Care Coordinator. My background is in adult social care, working in care homes from the age of 18, starting as a carer up to a registered manager.
Thank you, Lucy. And Oliver?
Hello, everyone. My name's Oliver Stirrup. I'm a Senior Research Fellow at UCL, University College London, and I work as a statistician, so that's working on things like data processing and analysis and reporting.
Fantastic, thank you. And we haven't got Rob on here, but could I ask Rob to introduce himself from Skills of Care? We're lucky to have him.
Hi all, yes, Rob Hargreaves, Central Engagement Lead at Skills for Care, supporting Mike and Oliver with the training of Vivaldi and also some of the recruitment.
Fantastic. Thank you so much. I just wanted to give a little bit of history. So it was mostly about 3 years ago now. Laura presented at a Care Quality Commission Trade Association meeting about Vivaldi and what they achieved during COVID. All of the different trade associations were offered the opportunity to get involved in Vivaldi Social Care, because obviously COVID isn't the only infection that causes care homes to close or has an impact on people's lives in care homes. So the Outstanding Society said, absolutely, we want to get involved, and Care England as well. So ever since then, we've had UCL, so our academics with providers and policymakers working together and co-producing this project. So if we can go on to the next slide, please, Mike, and play the animation to tell us a bit about what it's about.
The Vivaldi study was set up in 2020 to monitor the spread of COVID-19 in care homes. We've come a long way in fighting the virus, armed with a range of vaccines and a greater understanding of how it affects us. We now want to apply what we've learned to tackle other kinds of infections, like flu and gastroenteritis, which can make residents really unwell and cause outbreaks that could stop relatives from visiting. To do this effectively, we need data. What do we mean by data? Data is just another word for facts and figures, information no different to the records kept by the NHS about you, your health, and any treatments or vaccinations you have had. This information lets us build a picture of the nation's care home residents in our collective fight against infections like flu and COVID. It helps us understand how many residents have been infected, their body's response to infection, and the effectiveness of vaccines. We understand that this data is more than just numbers. It's precious and personal, and needs handling with the utmost care. This is why it will only be seen by staff who have been specially trained and approved to protect confidentiality. The data will be anonymized before it is shared with researchers, and it will be kept safe and secure here in the UK, protected by independently assessed security systems equivalent to those used by the NHS. We want all care home residents to benefit, so we would like to collect information on everyone to avoid gaps in the data. We also know that not everyone wants to share their data, so you can opt out if you don't want to take part. It's as simple as speaking to your care home manager or Vivaldi's social care lead to let them know if you do not want your data included. With this data, we can continue to understand how infections such as flu, COVID-19, norovirus, and UTIs affect those living and working in care homes, and the ultimate goal of reducing infections, improving lives, and keeping our care homes open to family visits.
That's fantastic. Thank you, Mike. The wonderful Stephen Fry. And that's just an example of something that's been co-produced by people who live in care homes, work in care homes, and policymakers as well. I think it would be great to hand over to Laura now, just to hear about where Vivaldi first started and where we are now. Watching the animation, we've come so far since making that animation. So over to you, please, Laura.
Yeah, thanks, Zoe. And I know nobody wants to talk about COVID, but COVID is the reason that Vivaldi started. So we were asked to set up this project essentially because we were all hearing the terrible headlines and things that were happening in care homes because of COVID, but we didn't have any data. And if you can't measure things, it makes it very difficult to know what might work to try and improve things in care homes. So we set up Vivaldi very quickly in around 300 care homes. And we were not doing standard research. We were really focused on what information do we need now to try and make things better. So we were able to show things like if you pay sick pay to care home staff, that means that the number of infections will go down. If you reduce people working across care homes, it will reduce the number of infections. And things like showing how well vaccines were working, who needs boosters, and so forth. So really about information for action and trying to use research to reduce the impact of the pandemic. But while we were doing all this work, we thought, well, if we can do this kind of work now, when it's really difficult during COVID, we know, as Zoe said earlier, there are so many other infections that cause problems in care homes, norovirus, flu outbreaks. There are all sorts of reasons why homes close to visitors, and we could stop that. But we also thought, well, it's no good us having big ideas in a university. It can't be led by us. It needs to be led by the care sector. And that's really why we reached out to Zoe and we're presenting at the Trade Association to say, look, does somebody want to partner with us? How can we work together? And that's really been the story ever since. We've built this great partnership with care home residents, so people like Judy, people like Kate from Rights for Residents, and academics, policymakers, all working together to design a project that lets us try and reduce the impact of infections in care homes, but doing it in a way that works for the sector, that isn't creating lots of extra work and is starting to use the data that sits in the background. I'll stop there, Zoe.
That's wonderful. Thanks, Laura. And can I come across to Judy, please, just to tell us why you think it's so important as a resident?
I found it very interesting when you came to present the whole scheme to us, and I think other people in the care home I'm in said the same, and relatives. And so I was very pleased to be able to sit in on the monthly meeting and keep track of what was going on. But at the same time, I was able to look at what was happening in the care home that I'm in. And I can see that, certainly in our case, it seems to be that urinary tract infections are the greatest infection. And the one thing that everybody says is that we want to be able to be looked after here in the care home and not be sent into hospital. So the more information that we can learn from this scheme, the better for the residents that I am here with. I've been here for 3 years. Sadly, I think I'm here for another 3, but all the work that is being done will last for a very long time as we get to the results from it. And that's what's most interesting.
That's wonderful. Thank you, Judy. And I was very lucky to come along on the care home visit, and it was fantastic because we had actually, I think Chris was on the visit and Lara, and Laura, can I come across to you and say, how does hearing from residents like Judy on these care home visits impact what, as a researcher, you're going to take forward?
Well, I mean, I'm biased, but it's always brilliant hearing what Judy has to say. So what I would say on that is, at the beginning of this project, it felt like it was like being a one-person outfit. It's important, and you're talking to people about it all the time, and you're saying, look, this could make a real difference, but you also recognise you're one person. And what's been amazing for me is I felt at the beginning this was very much UCL academic led, but over time it's become a bit of a coalition and more like a campaign. And now in lots of meetings, as you know, I do not do a lot of talking, which I'm very happy about, and everyone else is saying why this matters, because it's not ours, it's not UCL's anymore. It is owned collectively. We make collective decisions, and we are trying to address the problems that people like Judy are describing to us, like UTIs. And so that is exactly as it should be. We should be enabling people to answer the questions that we need to answer in care homes. And I feel like we've really managed to get to a point where that's exactly what we're doing, and that's great.
Wonderful. Thank you so much, Laura. And can I go on to the next slide, please? And I'm going to hand you over to Mike to talk about numbers and where we're at. Thank you, Mike.
No, thank you. And it's just from the study group's point of view, it's so wonderful to hear from residents that are on the sharp end of this. It's just what we do this for. So yeah, my kind of update really is around numbers. Now, the for those of you that haven't seen this, our task was to try and onboard as many care homes as possible into Vivaldi. Our task was between 500 and 1500. We are always accepting more, so if there are any more out there, please do sign up. We've got wonderful representatives from Camascope, Nourish and PCS on the call today, so I'm going to hand over to them in a minute just for a quick update from each of them. But if you use any of those digital suppliers, you can be involved in this. So that's the word we really want to spread, is please be a part of this, because the more data we get, the more powerful this study becomes and the better we can serve our residents. So essentially, yes, this is where we are. There's a few more than that now. It's ticked up in the last few days. So we're nearer 700 than 668 now. But as you can see, we've got some really large groups as part of the study, which is kind of one of the big selling points for Vivaldi, is that it's actually very, very simple to take part in. So it's a real sorry, was that for me? No. Okay, good, cool. So yeah, it's a real simple process, and as Laura said before, it has to be a simple process, because actually what we want is for the teams in homes to make sure that they're doing the best they can for the people they're supporting, rather than having to put data entry at the first thing that they do. And that was the whole premise for all of this. It had to be really easy for homes to take part, and we think we've achieved that, and not not in small part thanks to our wonderful partners in the digital suppliers. So it's a massive thank you to them as a first thing. So yeah, we're ticking up with numbers. I'll let Oliver talk about what those numbers mean for us in terms of data transfer later on, and what that looks like for what we're getting out of the system. But essentially what we do is we take an NHS number and we send it into the NHS data stream, which already holds all of our NHS numbers anyway, and we ally or align the fact that someone is in a care home to that NHS number, so that we can look at the data around that specifically. So we're creating this cohort of people that are just in care homes for us to look at more specifically, which gives us a much more specific idea of what the push and pulls are within care, and how we can adjust what we need to do around infections to manage those residents better. So that's what we're doing with Vivaldi. I would like to bring in, we've got the wonderful Richard and Amelie on the call from Camascope. I don't mind which one of you should be able to unmute. I should have done that, admin, fingers crossed. So if one of you would like to just come in and say hi to everyone, because this is just a chance to say thank you so much for all the work you've done, and also just let us know kind of where you are. We're live with you guys. We've been live for a really long time, and the process is going really well, and just kind of share your thoughts and maybe what it means to your customers. Either of you.
Thank you so much. I'll just say a quick hi. I think Richard has more to update than I do, because I only recently joined on things Vivaldi social care, but so excited to be a part of this, and I'm really happy to just be a part of something so amazing. And Richard, do you have anything else to say?
Yeah, I was just going to give a sort of quick update on where we are with I mean, we've been kind of onboarding homes for a while now, and it's a very simple process now. I think hopefully it is. Had a few teething problems to start in the first instance, but yeah, I think it's a lot smoother now. And in terms of our user interface, it's once you've agreed at a group level, then it's very easy to opt out any residents who don't want to participate, but there aren't many of those. I think just looking at our stats, there's only about 3% of people opt out at the care home level. So everyone else gets involved, and then you can just, then once the homes have done that, then they just click one button and data starts flowing. So yes, it's all going well, I think.
Yeah. Brilliant, thanks, Richard. It really is all going well. It's fantastic, and Richard has been the sort of design architect of this. So it's our thanks to Richard and all of his hard work and his team's hard work in putting this together, so that it was that one click. So yeah, Zoe, there's a question.
Yeah, thank you so much. So Diana said, are we looking to onboard more homes? So for me, these numbers are fantastic. 668, that's absolutely amazing. But for me, I would like to see all care homes. And I know Mike said that digital suppliers that we're working with. So we actually have got care homes that are on the waiting list, waiting for their digital supplier to come on board. And not forgetting this is a 12-month pilot. So we've obviously had teething problems, as my colleagues on the call have said. But that's the beauty of having a pilot, so that we can iron out those teething problems, so that the project can evolve and open up further. I know somebody said about larger providers. It's not just larger providers, Mike. I don't know whether you want to talk about the variety of providers that we've actually got across the board.
Yeah, I mean, we've got the 668 is represented by homes as small as 9 beds up to hundreds of beds. So like we are, and individuals, independents, anyone can be a part of this, as long as they use the 3 digital suppliers that we've talked about at the moment. As Zoe says, we're hoping to expand, but the 3 digital suppliers are where we are currently able to help people on board. anyone that uses those is welcome within the project, and very, very welcome within the project. We want as many as possible, and we're still happy to keep onboarding people. It's definitely not a closed shop currently. Okay, so yes, thank you very much for that question. It's brilliant, and thank you both, Richard and Emily. I'll go on to the guys from Nourish. We've got Sita, Tom, and Lucy here from Nourish today, so I should have unmuted all of you. If one of you wants to come on first, that would be amazing, and say hi.
Thank you. Let me start first, and I don't do as much with Vivaldi except enable it. It's Tom who does all of the hard work with the team, so I appreciate him sort of speaking a few words. But thank you for the opportunity. I mean, at Nourish, we believe that data and the insights that it provides is really important, and it data is only as good as the insights you take from it and the decisions you drive from it. So it's really exciting to be part of this initiative and this study, where we know that the data that our customers and their customers, so residents of care homes, entrust us to manage and process, we can make that accessible and provide that safely and securely to actually drive meaningful change. So this sort of aligns perfectly with Nourish's values and culture, and it's super exciting to be part of this and seeing how it evolves as well. So thank you.
Yeah, no, that's amazing. Thank you. And Tom, have you got any top tips that you'd share with anybody? I know I'm putting you on the spot there. You don't have to. I've got one if you haven't. But if you have got any top tips, that would be amazing to come in as like what you think it's enables Vivaldi for people.
No, I mean just to build on what yourself and Sudha have said, really, it's been going well for us. We've got about 160 homes that are sort of live transmitting data as of today. It's easy as well for users to opt in each of the homes, and then similar to what Richard was saying, is go in and opt out individual residents as needed. It's been good to work closely with Oliver and the rest of the team as well, just to validate things along the way. So yeah, good to get an update and exciting to see it moving on.
Yeah, thanks, Tom. And as Sita said, really appreciate your work. So the last, but very much not least, digital supplier that we have on the call today is PCS, Person-Centered Software. So if you guys use them, they are live pretty much as of today. So that's unbelievably exciting news. And yeah, it's really great. Actually, I think it's just Hacky on the call today with us. I don't think I can see Kieran, but if I've missed him, please let me know. So Hacky, yeah, do you want to share the great news with us, if you don't mind coming off mute?
Sure. Yep. Hi, Mike. Hi, everyone. Yep. PC is very glad to work with Vivaldi over the past few sessions to get this live. And yesterday we had a successful run through of the system from the beginning to the end. And we're hoping to put that to the test, barring a couple of data changes after recently. And yeah, it's great to integrate and make the data more useful. And we're all here for one thing: improving the life of the care home workers and care home residents. So it's great to contribute to this project to really help with that. And yeah, it's exciting that the technically is pretty much complete as well now. So yeah, thank you very much.
Brilliant. Thank you so much, guys. And it's the wonderful Sumathi, who's been the data engineer there, but is unable to join us today. So just a thank you to them. And a quick last thank you from me to the 3 homes that have been our guinea pigs. So there was Summerlands down in Haywards Heath who went live. There's the Grove up in Oxfordshire, and Bakewell Cottage in Bakewell, who've just gone live with PCS. So it's just a massive thank you to those, because actually the go live process in those first few sort of days, weeks, is a bit testing. So they make it easy for everyone else. So I really, my thanks go out to them. And my top tip that I was going to give everybody is get your IT admin involved in this from the start, because that's probably the biggest internal teething problem that we've had with places going live is that maybe certain homes don't have the right access requirements or those kind of things to be able to do what they need to do with this. So if you've got an IT department, get them involved as soon as possible, because that will really help. Okay, I'll shush now, Zoe. Sorry, thank you. That was a big update from me. But yeah, bless you. Thank you.
That was lovely. It's a lovely surprise to hear from our digital suppliers. I really appreciate everything that you've done. I just can't reiterate how exciting this is for adult social care. If you look at the NHS uses data all the time. We don't do enough of that in adult social care. So to have this pilot now with our 3 digital suppliers go live, it's absolutely amazing. That point, I want to hand over to Chris, because it's obviously really important as a regulator as well. If we look at our 10-year health plan and if we look at the professional nursing and midwifery strategy, why as a regulator, Chris, is it so important for you?
Thank you. Well, I want to go back to something that Judy and Laura said earlier on. The more we understand people's care and experience of care, the better chance we have of driving improvement and change. I am really keen for us to be part of what Vivaldi have started here. I actually see this as as part of something that potentially could be even bigger. How organisations understand how they're performing relative to others is a really strong driver. We see it in other sectors that we regulate, a really strong driver for change and improvement. I've seen organisations improve from inadequate to good because of the way they've used data to drive that change. And there's now a growing difference between homes and providers that can help keep people out of hospital, can help support people to live well in different parts of the country. And often the data links to wider sort of issues in organisations, like training, like the physical environment, the way people move between different organisations, relationships with other organisations, culture in an organisation. So that data isn't just a sort of it isn't just valuable in itself. It's valuable because it gives indications of other things that are important for us to follow up on. And I know some of the colleagues on the call today, we use that. We want to use that data to guide our thinking, to guide our judgment. So data helps tell the story of people's care. Better data, perhaps more real-time data, I think will help us make better decisions and ultimately drive improvements in the way people experience care. The challenge for all of us is, how do we build confidence in the way that we collect that information, and that it practically leads to a change and improvement in care. I'm really, I'm excited to be part of this. I do see this as a start of something that could be really big for the whole of adult social care, to really grasp some of the issues around change and improvement that we want to see.
That's wonderful. Thank you so much, Chris, and thank you to your colleagues who have been so supportive at the CQC. Rob, I was going to bring you in, so please do come in there.
I think it's just great to hear from Chris there about the CQC's view and support of all of this, because one of the first obstacles when we were first talking about engagement 2 or 3 years ago was, well, won't the CQC look at us as like, why are we still putting our head above the parapet? It's a risk to get involved in stuff like this. It's really quite the opposite. And I think another reflection really is just the levels of engagement and the levels of interest from providers. You've kind of smashed through the targets of kind of how many would be involved in the pilot. There's a waiting list. There's huge amounts of interest from community-based providers as a longer-term aim of expansion, I guess. And in a sector which it's pretty notoriously difficult to pilot new things, some great achievements here.
Thanks, Rob. I appreciate that. And I know that Skills for Care have been really important in the journey of supporting Mike and the team with training the care homes and providing information where providers can submit evidence to the CQC as well, and how to link that in across the key questions. So there's more of that to come as well. So thank you very much for that, Rob. I want to mention briefly now, and we'll signpost in the chat facility, we keep talking about training. There's actually some funding from NIHR that we've just seen, and I don't know whether Laura, you want to briefly mention that at this stage.
Yeah, I wonder if this is something that we can put in the chat. So it really is hot off the press.
Yeah.
So the NIHR support, so the National Institute for Health and Care Research have infrastructure funding to try and help community-based organisations get involved in research. And they have 3 tiers for this. And the first tier doesn't commit you to anything and doesn't actually require you to do anything, as far as I can tell. But the second tier up, I think there's £1,500 for signing up. And then beyond that, I think it ranges from 10 or 20 up to 100k a year for organisations that are willing to support lots of research studies. So what we wondered was whether homes that are taking part in Vivaldi or homes that might want to take part in Vivaldi in future could access this funding, and it would be a way to support all of our activities. And we're, as a team, very happy to support applications to this. So I suspect we will be sending things out to you soon to hopefully try and make this easier. But if this is something you might consider, I think it would be great because it would give you some funding to support being involved in Vivaldi.
Fantastic. Thanks, Laura. And I've just posted in the chat facility, and as Laura said, the team are really happy to help you try and apply for that funding as well. Thank you. So can we go on to the next slide, please? Lovely. And I'm going to hand over to Kate and Lucy now, just to talk a bit more about engagement, and I'm sure Judy will come in too. Over to you, Kate and Lucy, please.
Hi. So my name's Kate. Obviously, I'm a member of the Adult Social Care Engagement Collective, which is what this meeting is all about. We are also very privileged to go along with the team as part of the care home visits, and you can see various pictures on the slide in front of you. We had a brilliant visit last month to Adelaide House in Walton-on-Thames. It was an opportunity, chief scientific advisor. It was a chance for her to catch up with the project as well. She joined the team 6 months before, so it was a great opportunity for her to hear about the progress that the project's made. But as always, for me, it's the conversations after the presentation that are really important. And it was again reiterated by some of the care home residents how important UTIs are and looking into UTIs. And that was the sort of main topic that they were interested in, having heard what Laura was talking about. But also to speak to Victoria, who's the HC1 infection control lead, and how they as a bigger group have rolled out Vivaldi throughout the care homes and throughout all their care homes, and how they keep it relevant into all the residents and relatives meetings. They have it as a topic point where they put the posters. And so from a personal point of view, it was as always really informative. But Lucy, do you want to come in?
Yeah, absolutely. Hi, everyone. So yeah, as Kate says, we have the Adult Social Care Engagement Collective, which is fantastic. It's every month, and we invite everyone to that, which normally takes place today. And it's a mixture of everyone, from relatives, residents, policymakers, academics, and we all get together to make decisions. And that's fantastic. So that's what this is all about, making decisions together. Also, as Kate mentioned, the care home visits, there's nothing we love more than a care home visit. It's my favourite time of the month. We love to come out and visit, and it's run, every care home visit is different. Sometimes we go to care home visits like the one you see on screen, there's lots of people. Other times we have we just meet with residents, or sometimes we just meet with the staff, and it's just getting our voice out there about the Vivaldi Social Care Project. And we love the visits because we get the most engaging questions. It's the one time we get the questions that test us. They're always the best ones, and Yeah, really, really great. We've recently nominated 2 of the nurses who have been so engaged in Vivaldi Social Care with the Social Care Leadership Awards, and they were both finalists in the Research Award, which was absolutely amazing. It was the first time this award was given, and actually one of the nurses did win the award. But for both to be listed as finalists was amazing, and it just shows that research is finally spreading through the adult social care world, which is amazing. Yeah, but I think that's kind of everything we do. We do so much more, and I don't know whether Judy wants to come in and say how you felt the visit went when we came. Yours was quite a big visit, and I just wondered if you wanted to talk to us about how you felt that went when we came to visit you.
When you came to visit us, it was the very first we'd ever heard of anything like that. And it was amazing the way the questions came up. And there were some very good questions. Not that they were questions more about how you are achieving than questioning about how the system worked, which I found very interesting, because it obviously meant that, particularly to residents, achieving a success is extremely important. I have to say, sitting here today, I realise that perhaps we don't spend enough time in our care home reminding everybody about Vivaldi. I mean, I do it once a month when I've sat in on a meeting. I go down and try and remind as many people, but I'm not sure that we remind enough of our care staff. And I think I'll do some work to improve that.
Excellent. Okay, I can I just add one more thing is when Diane and I first met with the team, we were really surprised that this didn't happen already. Given everything that I hate bringing up the COVID side of it, but given everything that we'd all been through as relatives with loved ones in care, it really was quite surprising. Care homes are unique settings, and so for us it was extraordinary really that this didn't happen already. But it's fantastic to be a part of the group and listen to really what the care home residents want most, and to meet lovely people like Judy.
That's wonderful. Thank you so much, and I'll go away with another list, Judy, because I think there are some really great models that other care homes are following to share this information far and wide. And what we want is we want Vivaldi social care and research in general to be part of a care home culture. So everybody should be talking about it, whether they're a chef or the maintenance man, the driver. We want everybody talking about Vivaldi social care as part of the culture. And part of that is we've already spoken to CQC operational managers and inspectors about what they expect to see when they go out to homes, and participating homes are proud to provide a certificate by their front door to say we're proud to participate in Vivaldi social care, which I think is really important as well. It shows that you're being innovative, effective, well led. It falls under so many different categories. I'm going to move on now to some initial results that we've got. Can we go to the next slide, please, Mike, and over to Oliver?
Thank you, though. So I'm just going to talk through, give kind of overview of some of the initial data coming through to us now. So as has been mentioned earlier on today, we're still in the kind of pilot phase of the Vivaldi social care project, and a key part of that is setting up this automated data pipeline where information regarding the residents of participating homes is getting automatically sent through every day from the digital record systems that are participating through into the NHS England kind of data systems. And this is not entirely straightforward thing to do, as this is a complete first for the UK. And I'm not sure anything quite like this is actually happening anywhere in the world, as far as I know, either, in terms of that partnership between the private providers of care and their record systems, and then partnering up with the kind of national healthcare systems and the national healthcare data sets that exist. So the kind of first pilot homes were going live early this year. But as this was a completely new system, a completely new way of working, it then took a little while to kind of refine those kind of data pathways and processes to make sure everything was functioning exactly as we wanted. But the really exciting thing is that as of late July, we started to actually get through these kind of data for a quite substantial number of participating homes. So there's kind of little graph at the bottom left there, which shows the kind of sudden jump in the number of active homes in terms of transmitting data from the end of July, when we jumped up to about 100, and it's been ticking up ever since. So the data actually on these slides are from a couple of months ago now, so we've actually got more homes live. So as of a couple of months ago, we had around 150 homes, around 5,000 residents with data being transmitted from those participating homes that have been activated. It's now ticked up further towards more like 200 homes, and we are really, hopeful that we'll be able to get, several, a couple hundred more homes actually live in the near future and really get those numbers up, so that, we're kind of processing homes through the pathway of first enrolling into the Vivaldi social care project, and then actually getting this data pipeline up and running, which then requires a bit further processing, that we need to make sure that all the residents of the homes have been informed of the project before the data transmission goes live, so they have the opportunity to opt out. And there's been this kind of staggered introduction as we work with each of the digital software providers to ensure that their systems are working exactly as intended on their side and on our side. But as Micah said, it's absolutely brilliant that for our pilot providers, all 3 out of 3 are now live in transmitting data for the residents of at least one participating home, allowing us to really scale up the project. And because we've had this kind of substantial amount of data coming through from July, we've now got enough data to actually start working with as researchers, and start to really plan what our initial reports are going to look like and how we're going to be able to best share these data back to participating homes. So I've got a couple of pieces of kind of example information summarized here, just to give you a kind of indication of the able to start reporting back and giving kind of accurate actual numerical information on. So I've got a summary at the top right with a pie chart showing some kind of broad breakdown of antibiotic usage in the 139 homes that we have transmitting data as of July. And as you can see, as we've discussed, quite a big chunk of the antibiotics used at home participating are specifically used for urinary tract infections. So nearly 40% of the antibiotics being used are drugs that would only be used in the context of urinary tract infections. We've also got quite a substantial number of drugs that are used just for skin and soft tissue infections. But then we have about half the antibiotic usage is more kind of broad use drugs, where it might be for a range of conditions. So we need to do more work to kind of pick apart the information that we have so that we can make best use of these and see how it can be most useful for really measuring the impact of different infections on care homes. And how we might be able to then use that to kind of report back in a really useful way to the care homes themselves and other stakeholders in this area. So yeah, we've got kind of 4 key data sets coming through at the moment in terms of being the data that are being linked to the residents of participating homes. So we have the primary care prescriptions data, and we have information on attendance of emergency departments of hospitals and then admissions to hospitals, and then we do have data on mortality and causes of death as well. So we can start to look at things like the variation in the rates of hospital admission between participating homes, and there's a plot at the bottom there just showing the kind of spread of observations we've seen so far in June and July of this year. And we'll be looking into the factors that then influence rates of admissions, because we understand there is a lot of variation in the nature of the homes themselves and the residents they take on in terms of their age, in terms of their comorbidity profiles. And we'd be looking to try and really understand the factors that influence rates of hospital admission and the reason people are being admitted to hospital, with a real focus on infections, as that's our core research target. All of the data coming through to us is linked to the CQC ID code of the participating homes. We can then use that to link to things like the geographic information, and also any publicly available data through the CQC website, etc., such as the number of beds, and whether those homes are registered as providing specialist dementia care and specialist nursing care. So we are in the early phases of really getting to grips with these data, but we've got a great team. So within our research team, we've got public health clinicians, we've got an infectious disease consultant. So we've got some real expertise within the team in terms of starting to dig into these data and really understand them, how they can be best useful. And we are also working very closely with UK HSA, both to understand the data, but then also to develop ways in which it can be then fed back to the participating care homes. So the plan is that UK HSA are going to be creating a kind of dashboard system where both cohort level and care home level aggregated data will be presented back to participating care homes. So we're aiming to do that on a kind of monthly summary level and on an annual summary level. And we're just currently in the kind of final stages of planning the exact data specification that we're going to be sending on to UK HSA for them to then develop these dashboards to then provide back to the participating homes. I think that's, we're hoping that'll be then a kind of long-term process of really understanding what's useful for care homes, what they need, how best to communicate it, and have a kind of, I think we're imagining that there'll be a kind of cycle of feedback and improvement and development as we go with the project, and can hopefully develop it more into the medium and long term. I think that wraps up what I've got for now. So I think we're moving back to Laura, if I understand.
Yeah, no, that's brilliant. Thanks so much, Oliver. And Diane has asked a question, what will happen with the data once we've collated it for UTIs? So I wonder if, Laura, you want to come in and put it into, practical terms. How can we then work with care homes, teams, other specialties as well, with the data that we find?
Yeah, I can certainly try. So we're right at the start of how we do this. I think that's the most important thing to say first. So as Oliver said, our initial plan is working with UK HSA to create dashboards. So that's our way of sharing information back. We've always been very clear that this is about data to be useful. So that means we've got to give it back to care homes. So that will be care home level data. So homes can see their own data and they can see how they compare to other care homes. We also really understand that comparing care homes is not straightforward. And so we're doing some other work in the background to think about what do you need to know about a care home to be able to make a meaningful comparison. So that's just the data bit. But as Chris explained really clearly earlier, data starts to tell you information, but it only gives you a bit of the picture. So the kinds of things we could do is we could look at care homes and say, oh, look, these homes have high rates of prescribing for UTIs and these ones have low. That doesn't mean one home is doing things better than the other necessarily. But what we need to do then is go into those homes and do more detailed research. So asking people questions, interviews, that kind of thing, to say, well, what's driving this? Is it because the people in these care homes are totally different? Or are there other reasons? Are there things that we could learn to share best practice across the sector? So it's really saying the data is very helpful for giving us an indication about things, but then we're going to need to use other methods as well to really understand what's going on and start driving best practice. And I'm probably jumping the gun here a bit, but sorry, Zoe. But we're really keen to start thinking about how do we do more complex kinds of studies in care homes so that we're generating the evidence we need to answer the questions that are being asked to us on our visits. So as various people have said, key questions we get are, we don't want to go to hospital when we get infections. Why does that have to happen? How can we prevent those infections so people don't need to go to hospital? Or other questions that Kate, certainly Miko, said to me many times. When there are outbreaks in care homes, they close homes to visitors, and that is the key thing we want to stop. So the data helps us get a better handle on these things, but it doesn't solve it. And to solve it, we need different kinds of studies. And so what we're really looking to start doing next is more complex studies where we can test out new ways of trying to stop outbreaks, trying to stop people getting urinary tract infections, or trying to make sure people get the treatment for those urinary tract infections quickly so they don't go into hospital. And we've seamlessly moved on to the next slide. And so it's really thinking about what could a long-term, bigger program of work in this sector look like. And so we're starting to put in applications for grant funding to try and build the system that we would need to do this. So with lots of training for care homes, with lots of investment in data, to think how can we make research work in social care in the way it is working in the NHS? And how can we start getting the answers to the questions that people are asking us so we can improve the quality of life for residents? So we've got lots of ideas for where this will go, and data is very much the starting point. Thanks.
That's brilliant. Thank you so much. And I don't know whether you've covered everything that's in your final slide, but I just want to reiterate that it's really important for providers not to be concerned about getting involved. This is about learning from best practice as well, and sharing what others are doing. And Laura's mentioned a lot about benchmarking, and homes are very different. There are so many different variables. GPs prescribe differently in different areas. It might be that you've got one care home that has 5 GP practices to deal with. Another care home might just have one GP practice, and they've got some great policies. But hopefully, as time goes on, our data will allow us to generate policies for adult social care, because a lot of our policies at the moment are based on what happens in the NHS, and care homes are very different places to the NHS. So I'm just have I answered all the questions in the chat facility? Would any of our speakers like to come on and do a final few words about Vivaldi Social Care, or pose any other questions while we've got the Vivaldi Social Care team on the call at all? I know that we've posted lots of links in the chat facility as well, and this will be available on the website for everybody to watch again. Any final comments? The pilot could not have worked without the input and enthusiasm of our lovely care homes. That's lovely. That's lovely to hear. Mike, do come in, please.
Really, just that. That's kind of what I was going to say. I just think that we've been so lucky as a team to have engaged with such wonderful and diverse people across the sector, and this sort of, as Chris says, there's larger work here in terms of bringing stuff together, not just about feeding some data into the system, but actually we've created a really strong network to build on, and Laura's sort of plans on that are exponential. Really, they're just huge. So it's just an absolute pleasure to have worked with everybody doing this, and just a thank you, really. Yeah.
Thanks, Mike. Chris, do come in.
I'm just going to reiterate, so I'm really excited by what Laura's talking about at the end there. There's a really important part for me that I think often regulators are sometimes seen in a slightly negative sense of looking for things that aren't working. I think there's a real opportunity here to try and map out what should work and how services should operate together. And I think some of this goes back to the NHS has got a lot of data, but actually I think there's a chance to build not just data but intelligence with this about what does this actually mean, rather than, because I think that the NHS does speak to somebody who used to work in the NHS, it is data rich but not necessarily intelligence rich. And I think the opportunity here is how do we collectively work on this so we can make the right, because this ultimately influences policy and the way in which services operate, not just individual organisations, but the way in which we commission services, how services work together. And if the issues, there's an issue in the 10-year plan around neighbourhood health, well, what that actually means and what that looks like is to a large extent how we get the data and information right at this point to try and influence those decisions in the right way. So I'm really supportive of this and really optimistic about what we can do with this work.
That's fantastic. Thanks, Chris. Well, if we don't have any other questions, There we go. Got 2 hands up now, and I can't see on my screen who's first. We can stop sharing if you wanted to, Mike, and then we'll be able to see people.
I'll let Laura have the last word and go first if that's all right. I was just going
Absolutely.
to say thank you everyone for, as you know, as I said earlier, as part of sort of Nourish culture and value code, we take our responsibility around being we don't just think we're digital care providers to the social care sector. We're a partner and we want to make this sector better. So we're really proud of this initiative and really looking forward to working further on sort of this mission, let's say, of changing sort of the landscape where we're really right now. Social care is quite data poor as well, right? So data poor, insights poor, intelligence poor into, well, data rich, intelligence rich, and hopefully action rich environment where we have that continuous feedback loop. So really excited about the mission and the partnership with this group. Yeah.
Thank you so much, and thank you for being one of the leading suppliers. Wouldn't it be wonderful if all assured digital suppliers had to be part of Vivaldi Social Care and have this facility on their system? Really appreciate you being part of it. Laura, final word to you, please.
Yeah, you know, I'm always off on a campaign of some description. So, I mean, something that has really struck me, having worked mainly in NHS before COVID, is the parity of esteem issue between health and social care. And I really think that having better data is part of the solution to that, because then you have the same statistics, you can have the same visibility as the NHS has. So that's something really important that we need to do. And then another part of that is recognising, as many people have said, the amazing people who are working in social care, who have given up their time to work with us to make this happen. There are so many career and developmental opportunities related to this kind of work. And we really want to enable people in social care to develop careers, and anything we can do to support with that. So it's just really taking a very broad view on this and recognising the scope of opportunities. And we are usually up for pretty much anything. So we're really open to hearing ideas for what people want to do in the direction that we should be going in. So just tell us and we'll try and do it. Yeah, so
that's fantastic, and we've got our final care home visit of the year tomorrow, and I just wanted to say a huge thank you to our members of the Adult Social Care Engagement Collective. And if anybody does want to get involved further, they can also be involved in the Adult Social Care Engagement Collective. But thank you all very much, and I hope you enjoy the rest of your day. Many thanks.